Dr. Eric Sleep, Sports Medicine, Part 2 on our series of knee pain differential diagnosis based on location of pain. So today will be the lateral knee that we'll be taking a look at and determining the differential diagnosis based on pain along the lateral knee or symptoms along the lateral knee. So we're going to draw a quick little drawing here. Again, a front view of the knee. Again, this is just a cartoon drawing just to help you understand. Again, once again, here's your femur, tibia, fibula, and patella. Along the lateral knee, there are basically three structures that we're going to spend a little bit of time with. If you recall, we talked about the medial meniscus. We also have a lateral meniscus. Lateral meniscus is this structure right here. It's your cushion. The lateral meniscus is basically a little kidney bean shaped structure that provides cushion or bumper between the femur and the tibia. It can get injured with pivoting, cutting, twisting, turning. People will sometimes describe a pop. Sometimes they'll describe it as like a rubber band type of sensation. It'll cause some mild to moderate swelling inside the joint when they get it. They will also sometimes feel a clicking or a popping when they do certain maneuvers after the injury occurs. Now, next to that structure, we have what we call the fibular collateral ligament, or also known as the LCL, lateral collateral ligament, LCL. This ligament holds the femur to the fibula. So injury to this ligament will typically occur with some type of stress that comes from the inside or medial side of the knee and causes this ligament to get stretched, okay? And this ligament is involved in preventing what we call a varus force, so getting struck from the medial side. Again, this ligament sits outside the joint, so it usually will cause swelling along the lateral side of the knee, but it will typically not cause swelling inside the joint. And finally, the last structure, it runs along the back of the knee, and this is your hamstring tendon. So this is coming from behind the knee, attaching onto the fibula. And this is known as your biceps femoris. There are three tendons which make up the biceps. Three tendons make up the hamstring. The biceps femoris is one of them, and that runs along the back of your thigh, and this particular tendon comes and attaches onto the fibula itself. This can be a form of tendonitis, so overuse type of phenomenon. So it can be due to overuse. And they can also feel a pop if they're making a quick start to start running. So a lot of people, like in a standing position, go to a quick burst of movement forward, can cause an injury to this tendon, most commonly the muscle, which is higher up in this area up here in the back, but they can also pull the tendon off of the bone. They will usually, if it's traumatic, have bruising in the back of the thigh, severe pain, painful to move the knee. But the bruising is one of the big keys that they get, which is typically different than your meniscus or LCL, which usually do not have bruising associated with it. So that concludes our simple differential diagnosis for lateral knee pain. If we just look at this knee model, This refers to that same lateral aspect of the knee. Here is your lateral collateral ligament. This is your meniscus right here. And we can't see it today, but you have your hamstring tendon coming down and coming and attaching onto the fibular head right where my finger is pointing there. Just so you can kind of see what the meniscus looks like. If we just kind of peel the patella away and we look inside, that is the shape of the meniscus laterally. Again, in the other lecture we talked about the medial meniscus. That's the misshape of the medial meniscus. We'll get to these other structures deep in the center on another lecture, but that's for the lateral knee. So in conclusion, hamstring injury, LCL injury, lateral meniscus injury. Thank you for listening.